So before we had a paid director, we started creating some products. One of the very first ones was Preventing Injuries, a Call to Action. And this product was because so many states did not acknowledge injuries as a public health problem or acknowledge or know that they had a role to be played. And so this product talked about injuries as a major public health problem and the cost of injuries as a public health problem. And we talked about promoting strategies that work and why local coalitions could be very effective in reaching out to the public so that they could be involved in health. We quoted numerous national leaders like the Surgeon General, C. Everett Koop, and an economist, and many national leaders. And importantly, we sent this publication to the state health directors and MCH directors and other relevant state people to push for injury programs in all states. Um, we were also trying to be leaders internationally. And so we sponsored a pre conference at the World Injury Conference in Melbourne, Australia in 96. It was entitled Innovative Strategies to Prevent Residential Fire Related Injuries. We had an international faculty. We had presenters from Japan, England, Australia, and the US. And I think we demonstrated that we could be leaders internationally. And then another foundational publication that we created, it was instrumental in framing state injury programs, and that was the 97 Safe States, 5 components of a model state injury program, and 3 phases of program development. We were very proud of this document, and it became the framework for stat visits and for states developing injury programs. And that was, I think, in 97. And then after we got a full-time director in 97 or 98, then we really began to push out consensus recommendations for state injury surveillance, um, using hospital discharge, surveillance for falls, stuff like that. But that model state injury program really put the meat on what a state program looked like. We talked about data collection and analysis, um, program design based on that data, program design, implementation, and evaluation, how states could coordinate and collaborate, uh, provide technical support and training, and work in promoting public policy. It really detailed for the states what a program should look like.